Tomorrow way too far away, and we can get back yesterday. But we young right now, we got right now, so get up right now, 'cause all we got is right now. Tomorrow way too far away, and we can get back yesterday. But we young right now, we got right now.
Hi everyone, my name's Lauren and welcome to my channel Low Beats Endo. For all of you who are new here, if this is your first video that you're seeing from me, I started this channel because I am a long-term sufferer of endometriosis. So I've been suffering with it for around 13, 14 years. So quite a while. I started this channel because I realized I'd been suffering with something and I didn't know anything about it. I didn't know what it meant to suffer with this. I didn't know exactly what it was. So I'm hoping that over the next few months on this channel, those who are here suffering with endometriosis will think that they're suffering with it, will be able to learn and grow with me as we go through all of the videos and we meet all of the wonderful experts. So on that note, I'm really excited to announce that I have Dr. Christopher Mann joining us here from the Spire Parkway Hospital. Hi, Dr. Christopher Mann, and thank you so much for joining us today.
You're welcome.
So could you give us a little bit more about you, a little bit more about your background, what it is that you've been doing, working on, and what you do at the Spire Hospital?
Yeah, so my name's Chris Mann. I'm a consultant gynaecologist. My background is originally, I trained as a gynaecological oncologist, which is a gynaecological cancer surgeon. And whilst I was training, I developed an interest initially in France in the laparoscopic treatment of endometriosis, and particularly excisional surgery for very severe endometriosis. That was back in 1999, which shows how old I am. And that was it was a form of treatment that I'd never seen or experienced in the UK. And I was fortunate enough to be working over in Lyon when I came across surgeons who were excising endometriosis laparoscopically. And that sparked my interest. When I came back from France, I started doing it at a very low level. I was a senior registrar at the time. And then I went to several places all around the world and within the UK to develop my knowledge and my expertise, and gradually increased my experience over the last 18, 19 years. So I now run a BSGE accredited or recognised centre for the treatment of advanced endometriosis. Oh, perfect, perfect. So I guess you're the perfect person for me to ask my first question to. So what is endometriosis in scientific terms? What's actually happening to the body if you've been diagnosed with this? So endometriosis is the presence of endometrial-like cells outside of the uterus. So these cells typically are found as what's called the endometrium, and they line the uterus and they come away every month when a lady has a period. For reasons that aren't really understood, and there are theories, but ultimately we don't really know how it happens. We get endometrial-like cells outside of the uterus, and that's most commonly in the pelvis, but it can be anywhere in the abdomen, it can be on the diaphragm, it can be in the lungs, it can go into the ear, nose and throat, into the brain, basically a lot of places in the human body, but most commonly in the pelvis and within the abdomen.
So in layman's terms, what would you describe endometriosis as being?
I suppose you'd describe it as tissue that should really be inside the womb that isn't. Right. And it causes problems as a consequence of being outside of the womb.
Right, perfect. That definitely sums it up. And talking about endometriosis being able to be in different places, I myself had endometriosis on my diaphragm.
Yeah.
It caused a lung collapse.
Yeah.
Very interesting. So that's something that I did not know was possible at all. I thought that, it only is around the womb area, and it wasn't possible for it to be anywhere else. So that's been quite an interesting thing to find out.
It's not particularly common, but it's not very, very, very rare that we'd see patients with diaphragmatic disease or on the pleura or actually inside the lungs. If you have cardiothoracic or diaphragmatic disease, we can help with it, and we've put together a team in the clinic that I run to help with this. But it does involve quite radical surgery, often involving 2 or 3 different surgeons from different specialities, because it's difficult to treat. It is treatable, but it has to be done very, very carefully.
All right, no, that's completely understandable. So what about these symptoms? If you think that you're suffering with endometriosis, what would the most common symptoms look like?
The commonest symptoms would be often following a cyclical pattern of very, very painful periods, sometimes pain leading up to periods, so for the week or 10 days beforehand, pain when you have intercourse, pain when you open your bowels, and sometimes pain when you're passing urine. They're the most common 5 sets of symptoms that we see. They usually follow a cyclical pattern, but sometimes they occur throughout the whole of the month.
So what are things that people might think are symptoms of endometriosis, but aren't? What are common things that people come to you saying, I'm experiencing this, I think I have endometriosis, but you'll be able to tell them, no, this is not actually a symptom?
So endometriosis itself doesn't cause heavy periods, for example.
Okay.
It causes painful periods, but it doesn't cause heavy periods unless it's associated with a condition called adenomyosis. The other thing that we sometimes get asked about is, well, I've got terrible constipation, and it's unusual that endometriosis would cause constipation. It can do in very, very extreme cases, but in the majority of patients with endo, they don't. And another symptom that sometimes seems to be linked in with endometriosis is excessive vaginal discharge, and that's not typically associated with endometriosis. IBS is probably the most common other condition that endometriosis gets misdiagnosed as. And IBS typically cause bloating, alternating constipation and diarrhea, which you can get associated with endometriosis, but they're not usually the cardinal or primary symptoms. And it's very, very common that a patient's had symptoms of 7, 8 more years, and they've been told often by several doctors that they've got IBS or PID, which is pelvic inflammatory disease, which is caused by an infection, and it can cause some symptoms that are similar to endo, but it's not endometriosis.
Okay, that's fantastic. So if you're watching this video and you're experiencing symptoms like that, do be sure to go and get checked out, because it may not be endometriosis, it could be something else that,
Absolutely.
it all looks the same sometimes. Talking about the symptoms, if you are experiencing symptoms of endometriosis, how could we get a formal diagnosis? Because I know for a lot of women, it's very difficult, firstly, actually getting diagnosed as having endometriosis, because you could get diagnosed as having IBS.
Yes.
But also, what's the process that you'd go down?
So the gold standard way of being diagnosed for endometriosis, or with endometriosis, is a laparoscopy. In the UK, that usually means going to see your GP first and talking it over with your GP and convincing your GP that really they need to refer you on to a specialist, so a gynaecologist, and ideally a gynaecologist with an interest in endometriosis. Some GPs are reluctant to do this because they may not be convinced that you have endometriosis, so often it is a matter of persistence, I'm afraid. We published some work over 10 years ago which showed that the average duration between onset of symptoms and reaching a diagnosis was 7.5 years.
Wow, that's a long time to suffer with this.
It's an awful long time. Hopefully that will come down because people like you are making videos such as this, and general awareness and social media will help. But general awareness amongst the general population who may have endometriosis then becomes greater, and they can go along to the GP and say, look, I think I may have endometriosis.
Yeah, no, that's brilliant. That's definitely one of the reasons, well, the main reason that I'm doing it, to raise awareness for this, and take away the fear that surrounds, the uncertainty. What is it? How am I going to get help? Will anyone believe me if I say that's what it is? So those are all really important things.
They're very important. Now, if you get to the point where you can't convince your GP that you want a referral to gynaecologist, you can always come to one of the clinics, and we do accept direct referrals. So if you're getting no joy, then you can always just call the hospital and arrange an appointment directly.
Oh, that's wonderful. So what I'll do at the end of this video, if you are interested in speaking to Dr. Mann and his team, I'll leave all the details so that you can get in touch with him directly. That's absolutely fantastic. So thank you for that. On the topic of diagnosis, you mentioned laparoscopy. So what is a laparoscopy? I know a lot of women are apprehensive about that, having that done. It's something that seems really scary and painful. So what exactly is it?
It's an operation. It's an investigative operation, and it involves the lady coming in, being put to sleep or anaesthetized, And then we use a small fiber optic camera that we put in through the patient's navel. And that allows us to visualize everywhere from the diaphragm right down to the pelvic floor. And then if there are any areas that are suspicious for endometriosis, they can either be biopsied if it's very extensive, or they can be removed at that time. The sample is then sent to the pathology department, and we get a histological diagnosis, which is definitive. So you're not just dependent on somebody looking with a laparoscope inside your tummy and going, well, that's probably endo, or no, that's definitely not. If you get a biopsy or removal of this tissue, it gets sent to the lab, and they will look at it under the microscope, and they'll tell you it's either there or it's not.
So it's not that scary then in that case?
That's usually done as a day case.
Oh, okay, brilliant. So you're in and you're out.
You're in and you're out. You're back at work within a few days. And then if you come in for that operation and you accept that if you've got a mild to moderate amount of endometriosis, that can be usually removed on the same day and home the same day. If it's more extensive endometriosis, then you would need to stay in longer, just usually 1 or 2 nights.
At least we know now that if you are interested in going for a laparoscopy, or if that's something your doctor has recommended, is something that you should do, because then we're able to understand whether you do have it or you don't have it.
Yeah, and it's very important that patients aren't labelled as having endometriosis if they haven't got it.
Yeah.
Because the risk with that sort of situation is that every time subsequently when a woman has abdominal pelvic pain and there's a presumptive previous diagnosis of endometriosis, the risk is that they'll just be labelled as, well, it's just your endo playing up. You just have some pain relief, which sometimes is wrong because it may not be endo.
What are the myths that you hear around endometriosis? Obviously, being a sufferer myself, and I am in groups of women who have the condition on Facebook, I do hear a lot of horror stories and a lot of people saying, to get rid of it completely, you should take this, or you have it because you did that. So what are some of the most common myths around endometriosis?
Probably the commonest myth that I hear in my practice is that a patient comes to me, they've got suspected endometriosis, or they've been previously diagnosed with endometriosis, and that they've been told you just go off and get pregnant and that will sort it out.
Right, yeah.
And it doesn't.
Okay, so what does that do?
The majority of patients, when they're pregnant, their symptoms will become quiescent, or they'll be dampened down, and they may even be absent, and that will continue. For example, if a lady's breastfeeding and they haven't resumed their menstrual cycle, that suppression of symptoms will continue. But once they stop breastfeeding, in the vast majority of patients, the symptoms will recur because the endometriosis is still there. Whereas when I was at medical school, in the textbooks that we used in the 80s, it clearly used to state that treatment for endometriosis was pregnancy. And we've hopefully moved on from that. The other big myth is just go and have a hysterectomy and that will get rid of it.
Yeah.
It won't.
That doesn't get rid of it?
No. It will get rid of adenomyosis, which is endometriosis in the wall of the womb. If you do a hysterectomy and leave extensive endometriosis, it's still there and it still causes symptoms. So it's important that if you do have a hysterectomy, that any endometriosis that is also present outside of the womb should be removed at the same time.
And I have heard of people who have had hysterectomies because they've been diagnosed with endometriosis. So I guess it's just really important that the issue is dealt with. On the topic of some of the myths, let's talk about pregnancy. That's something that I'm dealing with at the moment. Because of the stage that I'm at with the endometriosis, they're not sure whether or not that would be possible. So is there anything that you could do that increases your chances? Getting rid of endometriosis, does that help with pregnancy, or does that help to
Yes, there is published work now to show that your chances of having a baby are increased by having excision of endometriosis. So have the endometriosis removed. Now, it may be that you can then conceive spontaneously or naturally, or it may be that you need assistance, so assisted conception in the form of ICSI or IVF. Right. But it seems that even the results of ICSI and IVF seem to be improved with having had prior treatment for endometriosis to remove as much of it as possible, particularly if it's a large chocolate cyst or endometrioma affecting the ovaries. And if that's causing symptoms, we know that, and it's large, it seems to be that if you remove those, that the chances of assisted conception will improve.
Sure. So what exactly is endometrioma?
An endometrioma is sometimes called a chocolate cyst, and it's endometriosis that occurs inside the ovary. It forms a cyst, and each month blood is produced, and it goes into the cyst, so the cyst gradually gets bigger and bigger and bigger. And because it's old blood, it looks rather like molten chocolate.
Right.
Hence the name chocolate cyst, because when you open them up and you drain out the contents, it does look like molten chocolate.
Right, okay, so you learn something new every day. Endometrioma is like melted chocolate. So getting a diagnosis at the Spire Parkway Hospital, what does that look like, and what is the process that you would take us on?
So a patient can either self-refer, or they can be referred in through the general practitioner, or sometimes we take referrals from other consultants. It involves coming up for a consultation. We take a detailed history, and then we may perform certain investigations such as an ultrasound scan or an MRI, and then we talk to the patients closely about achieving a diagnosis, ideally through a laparoscopic approach. And that if we find endometriosis, the way that we deal with it at the Midlands Endometriosis Clinic is to excise the disease wherever possible. And now that may be that it's mild to moderate disease and it's just done in one go. It may be that it's very extensive disease, for example, invading into the bladder or the bowel, and that may be done in one surgery, or it may be done in two. And if we need to do a bowel resection, so actually take out part of the bowel when the disease is very severe, we usually use one of my colleagues who's a colorectal surgeon who has a particular interest in endometriosis and the surgical management of endometriosis going into the bowel or into the bladder. Similarly, if we think there's significant disease on the diaphragm or in the lungs, we work with hepatobiliary or liver surgeons and thoracic surgeons, so surgeons that are used to working inside the thorax or rib cage. So what we offer is a multidisciplinary approach. It's not just dependent on a gynaecologist trying to get rid of all of the disease himself.
That's fantastic. Thank you very much for letting us know that. So if you are interested in seeing Dr. Christopher Mann at the Spire Hospital, then please do follow the links below. Book yourself in for a consultation so that you can start having this looked at. So I guess in closing, what are the repercussions of not getting this looked at in time and, you know, getting a diagnosis and getting treatment?
If endometriosis is left untreated, there are two pathways that the patient can go down. One is that the disease may plateau and not get any worse. And the other more likely case is that the disease will progress. Now, we don't know what proportion of patients have disease that plateaus and just develops and then stays as it is. It's probably the minority. And certainly when I was in France, if you talk to the French endometriosis specialists, they believe that every case of endometriosis is inevitably progressive. And by progressive, I mean getting worse. So that the symptoms, particularly relating to pain at periods, pain with intercourse, pain with going to the toilet, and impact on fertility, the thought process is that all of those symptoms will get worse. And so the patient will have a lower quality of life and potentially will have reduced fertility.
Now we know we've got an overall picture of what endometriosis is, you know, what some of the myths surrounding it are, and the way that we can get treatment. So thank you so much, Dr. Christopher Mann. I hope you've enjoyed your time here today on Low Beats Endo.
I have indeed. Thank you very much.
Fantastic. So as I've said before, we will place all of the information below this video, so please do check it out. I mean, you've heard from the man himself exactly what it is, but also what can happen if you aren't diagnosed appropriately. So please make it, you know, one of your goals this year. If you think that you are suffering from it, if you've clicked onto this video because you think that you may be suffering from endometriosis, please do take the time to go and have a consultation and then get diagnosed. So we wish you all the best, and we'll see you on the next video.
Tomorrow.